Although we're talking about vaccine hesitancy, and South Africans have been urged not to assume that natural immunity will protect them from COVID-19 infections. The country is facing vaccine hesitancy, with many choosing not to be vaccinated. A webinar aimed at mitigating the impact was hosted by the Department of Health this morning. Only 22% of the country's population have taken the jab. Government has set a target of 70% to be immunized by Christmas. In an attempt to curb vaccine hesitancy, civil society as well as religious and traditional leaders have been urged to assist in encouraging vaccine drives. All right, let's get more on this, and we're joined now via Zoom by Chief Director of a Child Health Program and COVID-19 Team Leader at the Department of Health, Dr Lesley Bamford. A very good afternoon to you, Doc. Thanks so very much for joining us here on SABC News this afternoon.
Good afternoon, and good afternoon to the viewers.
What are the factors? I mean, I'm sure this is something that you discussed in that meeting that you had. What are the factors that are still contributing to the issue of vaccine hesitancy? I mean, I know that, many people had said earlier on that, let me just see how things go with those who are first in line, those who are first to take the jab, and then I'll take the vaccine afterwards. I'll go afterwards once I've seen a significant number of people having taken the jab. But still, there is this hesitancy. And we're sitting at 22%, I believe, of the adult population, still only 22% that have indeed been vaccinated. Let's talk about some of those issues that are indeed being the hindrances at this point.
So certainly, let's first start just by getting the figures right. So we are aiming to vaccinate 70% of adults, and currently about just less than 40% of adults have received at least one dose of the COVID-19 vaccine. But that does mean that there is still a very significant proportion of the population, the adult population, who remain unprotected. So in terms of vaccine hesitancy, we know that there are many people, there's a certain proportion of people who really are against being vaccinated, but there's a large proportion of the population who is not yet vaccinated, who are what we call hesitant. So they have some concerns. They might be waiting to, as you say, to see, wait for other people to vaccinate first. In addressing vaccine hesitancy, we really need to reassure people that the vaccines are safe and they are effective. Just less than 40% of adults in South Africa have been vaccinated, and we are monitoring adverse events very closely, and we really can reassure the public that the vaccines are safe and that they are effective. We also know that we need to work hard to make sure that vaccines are as accessible to people as possible, to make it as easy as possible for people to vaccinate. So we have a wide network of vaccination sites. We are trying to have our vaccination sites open over the weekends. As I'm sure people are aware, the upcoming weekend is Vuma vaccination weekend, our second Vuma vaccination weekend. So vaccination sites will be open over the weekend for people who are unable to access the sites during the week. We are also, as far as possible, providing vaccinations through outreach services. So trying to make it as convenient as possible for people to vaccinate.
Dr. Bamford, when you started answering my first question, you started by saying you wanted to correct some of our numbers that we have here at SABC News, and then you went on to say that in fact, it's actually just less than 40% of the adult population who've at least gotten the one vaccine. But the reality of the fact is that there are some people who had one vaccine and then didn't go for the second jab. So maybe what I should then be asking you is, how many of those just less than 40% that you speak of are at this point fully vaccinated? And by fully vaccinated, I'm obviously talking about having taken the double jab if it was Pfizer, or the one jab if it was Johnson & Johnson. So I'm trying to get to why our numbers would have been different, if they are indeed different, because I'm sitting with a figure of 22% that are fully vaccinated. So how different is the figure that you've got when I'm talking specifically about fully vaccinated individuals?
Our figures show that approximately 1/3 of adults, South Africans, are fully vaccinated. Some of those people are still in the 6-week period between their 2 jabs. Some people are now eligible for their second dose and have missed their appointment. So really, we urge everyone to come forward and be vaccinated. We're particularly concerned about people who have not yet had even 1 dose of the vaccine, and particularly the older people 50 years and older, and especially people 60 years and older. But vaccination, as you know, is now open to everyone 12 years and older. And so all of those people are encouraged to vaccinate, whether they are first-time vaccinators or whether they are coming for their second dose of their second jab of the Pfizer vaccine.
What are your thoughts on, some of the incentives? I know that you have been encouraging everyone to get involved in terms of incentivizing and perhaps encouraging South Africans to indeed go and get the jab. But I'd like to talk to you about, your thoughts on, some of these incentives and initiatives that are being done, some by corporates or different companies, where one would maybe get a voucher, or they're offering free this and that should you go and take the vaccine. I've been looking at social media, and there's a large number of people who see this as being, rather suspicious, in the sense that, why this seemingly desperate move or desperate measures, as it looks, to get people to vaccinate. I mean, what are your thoughts on these sort of initiatives? Like there's a 100 Rand grocery voucher, for example, that I've been seeing people talk about. But certainly, as much as it may look like a good thing, there are some people saying, well, this looks quite suspicious, actually.
In terms of the 100 Rand grocery vouchers, research has shown that one of the barriers to vaccination for a proportion of the population does relate to the costs associated with accessing vaccination. So we are piloting the grocery voucher really as a way of, for people. So just to clarify, the grocery voucher is available to people 60 years and older who vaccinate during November. And this is really aimed at offsetting the costs associated with vaccination. It is a pilot project. It's not using any government funds. And we're really testing to see whether this is something that will assist people to be able to come forward and be vaccinated.
Yeah, Doctor, of course, people, yeah, sorry, I just want to move on to this one, just because we're running out of time at this point. But, we have been told to expect, a fourth wave, and we were told it would be, around the earlier parts of December. And for lack of terminology, obviously, I shouldn't be using this, but are we on track for that in terms of, should we still at this point be so concerned about this early December, as we've been warned about the fourth wave coming?
So I think, as you correctly say, these are predictions and estimates of when the fourth wave will arrive. The pattern of the pandemic does show that it comes in waves, and the fourth wave had been expected in December. Our numbers are still low, and it seems that the fourth wave may be somewhat delayed and only arrive in January. There's a number of factors that affect this, some of them related to the virus, and particularly whether new variants of the virus emerge and become dominant. The bottom line is that there will be a fourth wave, and we need to prepare for that fourth wave. And the best way that we can prepare is by being vaccinated. And of course, also following regulations and non-pharmaceutical interventions, social distancing, wearing masks, etc. But we don't know exactly when the fourth wave will come. It will almost certainly come, and we need to be as best prepared as possible when it does arrive.
All right, Dr. Bamford, thanks so very much for giving us your time here on SABC News. Much appreciated.